Buffalo Public School leaders trying to address a number of behavior problems that have either grown or changed in the last couple of years. The Board of Ed hearing the results tonight of the latest youth behavioral risk survey and the way the pandemic impacted student behaviors for middle and high schoolers. So tonight, Sydney York breaking down what this survey shows about teenagers around the district and the resources available to help those who are struggling.
The Buffalo Board of Education held a work session Wednesday evening to discuss a youth behavior risk survey. Board members say the national survey conducted by the CDC will help target the social and emotional needs of students post-pandemic.
Due to closures that impacted student learning, decreased opportunities for physical activity and nutrition, and reduced social impact, interactions with peers.
President of Market Decisions Research, Patrick Madden, broke down data collected from middle school and high school students in the Buffalo public school system. Some data outlined positive outcomes like a decrease in tobacco, marijuana, and sexual activity among middle schoolers, along with a decrease in student reports of violence or bullying. However, data shows there are areas that need improvement.
So 1 in 10 middle school students, 10%, reported taking a prescription pain medication without a doctor's permission.
Madden also says the data shows middle school students are becoming more sedentary, partially due to an increased amount of screen time each day. There were also signs of worsening mental health.
The percentage of students thinking about harming themselves, or actually did try to harm themselves, increased over the past couple of years.
This mental health issue was also indicated at the high school level.
55% of high school students reported that they had recently experienced poor mental health.
Data also shows that in 2021, 11% of high school students reported suicide attempts, a decrease in self-perception, and an increase in sexual violence or abuse. Many of these issues are negatively impacting grades. Director of Social Emotional Wellness, Mai Wen, says every school is unique, so data is still being reviewed.
So our team will work with the schools to assess their data, to identify those gaps, and to create an action plan to support them.
The Board of Education says they're grateful to have so much data to pull from, and they're optimistic about the tools they now have to help students.
And so we know where we are, we know who we are, we know what we've got to do. We're pleased with our new leadership. We're going to get there.
If your kids are struggling with mental health, there are resources available. Erie and Niagara County Crisis Services have hotlines that are available 24/7. Those numbers are 716-834-3131 in Erie County, and in Niagara County, you can call 716-285-3515. Live in the studio, I'm Sydney York. Back to you, Anna.